Okay, well, welcome to the town hall. For the next half hour, Mr. Smith and I are going to try to give you an update of what's going on at Union. And I always like to start off with an eye care standard, and I'm sort of working my way through the words. So this quarter I'm up to the letter A, and we were using accountability. And the first things I've got up here are some of the things that we put on the original brochure. One, take care of being informed, and you're really doing that by being at a town hall meeting, so you're already doing that one. The second one is what I consider one of the most important things that we have in the organization, and that's whenever you are stopped by someone from the outside, you are Union Hospital. You represent Union Hospital no matter what, so that's a very important part of this. And of course that funnels into the last one, which is either solve the problem or find someone who can. And really the reason we go through these in the start is not necessarily for you to remember those three, but really to think about in your job, what does accountability mean on a day-to-day basis. We also like to go through some of the honors that we've received. In the last quarter, we were nominated by, or we were designated by Becker's Hospital Review. Becker's is a trade magazine in the healthcare industry, and they're kind of known for putting together a lot of lists, and during the summer they came out with 100 great community hospitals in the United States, and Union Hospital was one of those. We're one of 4 in Ohio, so it's a really nice honor that was kind of unexpected, but we're glad we made that list. Now, health grades you're probably a little bit more familiar with. They've been out there for a long time. They evaluate every hospital across the United States, and they designate them with various levels of awards. When you see the one that says Excellence Award, or it has the 5 stars across it, that means that you're in the top 10% in the United States. And this year, for the first time, we were designated in women's health. Now, you immediately, when you hear women's health, think of maternal child, but that's not what this award is. This is taking care of women in medical and surgical diseases or specialties that oftentimes women present differently than, like a heart attack. Women sometimes present at the emergency room with different symptoms. That we have outstanding outcomes for women. Now, if you look at their data, what they say is the top 10% hospitals versus the bottom 10% hospitals, a woman has a 55% better chance of surviving coming to a hospital in the top 10%. So we think we're offering a good product for the women of Tuscarawas County. We also received the Patient Safety Award again. We've received this for several years now, and I hope we continue to do it, because that means for all of our patients we are in the top 10% of the nation in looking at the patient safety categories, which are looking at falls, medication errors, low incidence of infection, and that sort of thing. Studer Group also recognized us for an excellence in patient care, and they looked at the core measures over a period of 2 years, and it was given as one of the hospitals in the Studer system that has had a tremendous improvement in the core measures. And then finally, another award we received was from VHA. This one's on the finance side of the house. Between, I think it was 2012, 2013, we had the highest decrease, or the best decrease, I guess I should say, in dropping our supply cost of any hospital in the 4-state region that makes up VHA Central. So, and it's case mix adjusted so that you can measure us against the large hospitals and some other things. So with that, I'm going to, I want to talk about new initiatives. Hopefully you've heard about the HUSH program. This is on the inpatient units where we are dimming the lights, getting quiet, providing a better healing environment between the hours of 2 and 3 in the afternoon. And that's been real well received. Also, we've added social workers as part of the emergency care team. You've always been able to bring a social worker to the emergency room, but now they're part of the team. We're finding that in order to try to keep our patients from having to come back, that there's a lot of need. Sometimes it's getting their medication, sometimes it's getting transportation, sometimes it's simple as do they have food at home to take care of themselves when they go home. So they're a very welcome addition to that team. And now I'm going to turn it over to Darwin and let him talk about the core measures.
We'd like to continue talking about the quality core measures. As you can see, these are measures that a portion of our reimbursement from Medicare patients is based upon our core measure scores. You can see that all measures in the third quarter of 2013, we were at a 97.3. We've done a good job, and we're now up to a 99.3. As you can imagine, very similar to our HCAP scores and Press Ganey scores. As we continue to raise this, so does everyone else, but we're very proud of this. We appreciate your good work, and as we continue to work on these, we need to think about our accountability and how we are accountable to ensure that we're continuing to meet our quality core measures. Hand hygiene is an initiative that we began in 2013. You can see that our goal is 80% in 2013, and we raised that to our goal of 100% for 2014. As you can see, we were up to 76% in 2013, and in the first quarter of this year, we raised our goal and went down, unfortunately, to 64%. So we brought in our consultant that looks at our hand hygiene and our hand washing and asked them, how are you evaluating this? What are you looking at? So that we could have a better idea as far as re-educating our employees and working together, how can we raise this number. And as you can see, in the second quarter of 2014, we were able to raise that to 93%. So we're doing much better. Once again, when we want to remember to gel in and gel out when we go in and out of patient rooms and use proper hygiene techniques. Our HCAP scores, once again, these are measures that we are used for us to determine part of our reimbursement. You can see the last bar in each set, the brown bar, is our second quarter of 2014 scores, are what we call our top box scores. Rating of 9 or 10 is about the 50th percentile, and most of our scores on this graph that you can see is somewhere between the 35th and 40th or 50th percentile, some a little bit higher. So we want to continue to work on those and continue to raise those HCAP scores. In the second screen here, you can see our hospital environment. We're around 40th percentile. Pain management, a little higher than that, close to the 50th percentile. And our concerns are communication regarding medications and our discharge instructions. So what we want to do is we need to improve these as we move forward with the Affordable Care Act and healthcare reform. Our discharge instructions and communication regarding meds are going to become a portion of that score that they're looking at as far as our reimbursement. Once again, as we move forward with our post-discharge phone calls, that will assist in this. We realize that our employees are doing a good job communicating this. As you know, when a patient is discharged, it's a time of transition for them, so sometimes they may not understand what we're telling them or how we're communicating that. So once again, with the accountability, what can we do to better help our patients better understand their medications as well as their discharge instructions? Our Press Ganey, you can see very similar to our HCAPs. What we're seeing is we have a little bit of a roller coaster going on. Sometimes we go up, then we go down a little bit and go back up again. In general, if you look at these, they would be trending upwards, and that's what we want. What we would like to do, and I hope you join me in this effort, is to stop having those roller coasters, level that out, and then continue to increase them from there. But you can see in our inpatient, we're above the 50th percentile there. Kudos to the emergency department who have raised their score for 2 quarters close to the 80th percentile, so we're doing well there. Outpatient, we're up above the 50th percentile, so we're doing well there. We do have some work to do with our first care and ambulatory surgery. Again, continue to look at these, trying to level those out and raise them up as well with the others. We always like to talk about our financials as we go through our town halls. This is for the first 6 months of 2014. You can see our inpatient, we billed about $34 million. Our outpatient, we billed about $79 million for a total build of $113 million. You can see that we've billed approximately twice as much on the outpatient side as the inpatient side. So once again, as Mr. James will talk about in a little bit, this is part of healthcare reform that we're seeing more outpatient than inpatient. We discounted about $60 million due to insurance allowance, bad debt, as well as charity care. So by the time we do that, we actually received about $53 million. We received from other sources such as our leases, cafeteria revenues, and other revenues about $2 million. So we collected a total of $55,463,000. So how did we spend that money? You can see salaries and benefits. We spent about $28 million on that. supplies, services, and other expenses, about $21 million, and insurance, depreciation, and interest expense on our bonds of about $4.5 million. So our total expenses were $53,700,000. So we ended up with a positive operating margin of about $1,671,000, or about a 3.1% operating margin. We want to keep in mind that if you recall, about 2 years ago, the state of Ohio implemented a franchise fee, which they essentially took money from each hospital by charging a fee and used that money to pull down additional federal dollars to invest in additional health care and other funds that they could use that for. So that was about $1.5 million that we invested. We did receive about $1,900,000 back, so that did about $400,000 of that did go back towards our operating margin. So we continue to look at how we receive funds and have money to continue to have a positive operating margin. The IHN sourcing group is a group that we are a part of. It started out as what was called the Friendship 7, and the Friendship 7 essentially were ourselves, some other hospitals in the area, Genesis Healthcare System down in Zanesville, and a few other area hospitals. We went together to create a cooperative so that we could purchase, go into a joint purchasing agreement and other, how we could purchase supplies and other services. We have now enlarged that, and fortunately with some other hospitals, we've been able to increase that to 10 hospitals in Ohio. We added Akron General Hospital as well as some other Ohio hospitals, and also 12 hospitals in Indiana. So we have a much larger group now, and you can see that our collective purchasing power is now close to $1 billion. We're up over $900 million and approaching $1 billion in purchases. So you can imagine with that kind of purchasing power, we can get a much better price for what we need to purchase in regards to services and or supplies. So we continue to improve that, and we have been fortunate we haven't had to change any products or vendors that we use. That may come, but again, we'll do that to make sure that we do meet the needs of our patients first and foremost, and patient safety as well as safety for our employees. Now, Mr. James.
Well, the next thing I'd like to talk about are the statistics. This is sort of a typical thing that you would be seeing with almost any community hospital in the country right now. We're trying to drive down inpatient admissions. We're trying to take care of people on an outpatient basis, and less of them coming into the hospital. And we've accomplished that over the past few years. We're seeing our admissions go down. We're seeing our patient days go down. Now, fortunately for us, we've kept these two numbers pretty close this last year in admissions. The length of stay has gone down, so the patient days have gone down, but the number of admissions have held fairly close to where they were last year. Now, another way to look at this is looking at it as average daily census. If you were working here in 2008, which was the peak year of inpatients that we had at Union, there were about 82.5 patients on any given day. So 82, 83 people was a typical day. Today, the first part of this year, it would average about 60 patients. So there's about 23, 22 patients less than what we would have. And that's fairly typical. This is where you're seeing the growth, emergency department visits and outpatient work. That's where we've continued to see some market share gain. Those numbers aren't significantly different, but it's the part of the market that's growing. And as you saw when Darwin was showing you earlier, that our income is much more reliant on the outpatient world now than the inpatient world. Surgeries and deliveries. Surgeries have continued to go down. My personal belief is that a lot of this is related to economics. People are waiting for meet the deductibles or putting off having surgeries. We know that we see a lot more surgeries towards the end of the year now than we used to see. They used to be kind of spread out a little bit more through the year. Deliveries have stayed pretty constant until this year. We always, when we get to the end of the year and we look at our data, we typically deliver about 55 to 58% of all the babies in Tuscarawas County. This is a pretty dramatic drop. You can see we went from 363 to 317. I don't know yet if that is an issue of we're losing market share or if we're just having a lot less babies in Tuscarawas County this year. So I have to kind of wait till the end of the year when I get all that data together. But that's probably something that's a little bit different to explain than what we typically have to explain with our data. Physician practice is one of the things we're doing in UPS, and you'll start seeing this happen over the next couple of years. We have a lot of single practices. That's how doctors used to practice. Now what patients tend to want is they want a group practice where they can go to. So I don't care, I don't want to, if I want to go on Wednesday afternoon, I want the office to be open. I don't want to have to find somebody else if my doctor's on vacation. So what we're doing is we're going to look at putting somewhere between 6 and 8 practitioners into any given office pod. You'll hear us use the term pod every so often. The first one we're going to do is we're going to take the former Dover ortho practice. You may have seen some construction going on over there. We're going to move the Dover Philly group over there. That's Dr. McFadden, Dr. Mukamala. They've got 2 nurse practitioners, and there's 2 more people that are going over there. And I can't tell you who they are yet because we're still in the contract negotiations. So it'll have a group of 6 over there, and then we'll be looking at moving some other people within the next year. The emergency center, something that we've all been talking about. Thought I'd give you a kind of a quick, here's what's happening. The new building itself will have about 37,000 square feet for the emergency center. You'll hear us use the word emergency center as opposed to emergency department because it's a little bit more comprehensive. It will have 2 stories in it. The upper level and the lower level. The upper level is where the treatment is taking care of the patients. The lower level is where all the staff functions are. If you actually were to walk through the cafeteria, go straight by the Rosenberry room and walk into that wall, there'll be a hallway there, and that's kind of the middle of the underneath part of that building. We're also going to have a huge basement. You know how we never have enough room for storage? There's about 10,000 square feet down there that's not good space to put patients in because it's kind of crammed up under the building, but it'll make a great basement for us. We're going to put another conference room in there, and our emergency prepared stuff's going to go down there. Now, one of the tricks is that we have the ambulances being delivered on the opposite side of the building than the walk-in entrance. The walk-in entrance will stay where it's at right now. We'll actually renovate the waiting room, and we'll renovate Express. That 6,000 square feet will actually be renovated and added back into there. But because there's a 17-foot drop-off between one side of the building and the other side of the building, the ambulances will arrive and the patients will be put in an elevator, and the elevator will come up into the middle of the ED. So that it's easier to move those patients while they're still ready for transport. Some of you may have seen this. Akron City is probably the closest hospital that has an elevator concept to bring people up. We will have a new helipad as part of the project because we're going to build the new emergency center over the current helipad, and it's going to cost us close to $17.8 million to do the project. Now, this is a picture of the emergency room. This is the current hospital. This is the current ambulance entrance, and this is the current walk-in entrance. So we're adding here. In order to keep this open, because we were going to keep the emergency room open during the construction, we had to build the building this way because it couldn't go any further than that hard line on this direction. So what we're going to do first is we're going to go out here. You know how the parking lot out there is kind of tiered? You kind of go, everybody's going down. We're going to bring that entire parking lot up to 1 grade, so that when we have all the parking spaces for the new building, there'll be about 20 of them, patients and families can walk straight in at that 1 grade. They don't have to go down. So you'll see a lot of fill coming in there. And then remember I said that 70-foot drop-off? But when you get to that wall, it's looking down into about 17 feet. Actually, there I think is about 13 feet. But it's going to be a pretty good drop-off. Because we're going to build where the helipad is here, the helipad will end up over here, but we're going to temporarily move it over there. If you look at, this is the medical office building, and this is kind of the warehouse area. We have to move it out of the construction zone in order to land in there. The second step we'll do is you'll put a big fence up, which is going to take a lot of the parking lot. They'll be constructing this, and they need the other area to put the supplies, the steel, the stuff, so that it can get moved in there. So that will all come into play and working. When we finish this building, which will take about a year, we'll occupy the top floor. We have to come back over here and do the renovation, the waiting room and the registration and all that. Well, when we're doing that, the basement of this building will serve as a temporary waiting room and registration and everything like that. And they'll also be putting the canopy up here. So that's the third phase. And then the final phase is to go back into that basement and finish up the stuff that was being used as a temporary area. Now, parking. The bane of our existence for the next little while, because when we start doing this, we lose all these parking spaces. During the construction, we will actually lose 160 parking spaces. Now, when it's all said and done, the construction's done, we'll have given up about 60 parking spaces, which is not a problem, because if you ever walk out there, that back row out there it doesn't have anybody in it, and that happens to be about 60 parking spaces. So we know we can live through that. But we are going to have a little bit of a problem when we're getting through the 160. We're trying to ask the emergency patients to carpool together so that they can plan their events. We will have valets starting, well, I guess they started this week, during the peak hours to help people park and address some of the issues, because we don't want people to have to walk long distances and that sort of thing. But parking is going to be a little bit rough for the next year. Now, looking at the timelines, on Monday we did the groundbreaking. And actually sometime within the next 3 weeks, they'll actually start bringing in that fill and start working on that, that phase 1. We were really going to start right after Labor Day, but because that parking lot was going to be the end of the project, now we've moved it to the front of the project, and they're still in a little bit of planning and getting the approval processes. So it's going to be a little later in September to start. Then you'll probably see the fences go up and all the construction start in November. And then we will be open about a year later, so Thanksgiving, Christmas of the next year will be open. They're calling that fall of 2015. It's fall until December 21st. And then they will then go back in, redo the ED waiting area and that ED Express area. That should take about 3 or 4 months. All the construction would be done about the spring of 2016. So the whole project's going to be 15, maybe stretched out to 18 months when everything's said and done. Okay, I'm going to turn it back to Darwin.
All right, this fall we'll be continuing with our engagement survey. As you know, the last 3 years we've completed an engagement survey in the fall of each year. Our survey is scheduled for the last 2 weeks of October, and we are completing action plans right now. Those are to be wrapped up by the end of September, and then we'll resurvey and find out how we're doing as an organization in regards to employee engagement and concerns that our employees have. Benefit changes, if you've gone to any of the meetings for our PTO and wellness programs in 2015, one of the big changes for benefits next year is that we'll be moving to a paid time off program. If you've gone to one of Tina Meyer's programs, she illustrates it with 3 buckets of ping pong balls, which basically signify your vacation days, legal holidays, and personal holidays. We're going to put those all into one bucket and call it a PTO plan. Basically, it combines those, making those days more flexible for our employees. There are some other benefits to that. There will be an option to cash out unused days, as well as bank a portion of those unused days. There's no loss of time off with PTO. We're going to continue with those same 3 numbers of days that you have now, put those together into one opportunity to use them. And would encourage you, if you haven't been to one of the sessions for PTO and wellness, that you attend one of those sessions. If you miss those, we'll post those, the presentations on UConnect, as well as you can feel free to contact either the Wellness Department or Human Resources for more information. Past experience, Mr. James has been through it 3 times. I've been through it twice myself. And after the first year, employees really prefer to continue with that PTO versus going back to the old way of having separated days. The other portion of the changes, the major changes for benefits under the wellness program, as we have the last 2 years, we're offering our employees the opportunity to complete a wellness screening as well as health risk assessments. Those are available in September. If you go on to UConnect, you can sign up for your wellness screenings now, as far as getting your biometric screenings and lab tests. And you can go on to our strategic health website and complete your health risk assessment as well. There are, as we did this year, you can receive premium discounts depending upon how your results are and for completion of your wellness screening as well as health risk assessments. We're going to add next year additional monthly incentives, which will, by completing things such as talking to your wellness coach, completing online trainings and education sessions, that you can receive additional incentives, and those will be paid out at the end of 2015 as either contributions to your healthcare savings account or your flexible spending account, depending on which plan you're enrolled in. If you're not enrolled in either of our healthcare plans, those contributions will be paid out to you as a cash incentive. We want to remind you that your spouse is eligible to participate. It's very easy for us to talk to you as our employees and communicate with you about wellness and things that you can do. It's harder to get to talk with your spouses. But even if they complete the wellness screening and health risk assessment, it gives them some good baseline data as far as here's where I am and here's where I can improve. So we do, again, encourage you to enroll your spouse as well. Again, encourage you to go to sessions if you have the opportunity to. If not, please contact them. They'll be happy to discuss that one-on-one with you as to how it will affect you. We always like to highlight some of the activities that we've had over the past quarter. As you may recall, we had the DASCO tailgate party over near the Healthplex. Very well attended, and a lot of good food was consumed as well. We also had State Representative Al Landis visit Union Hospital. We always like to have our representatives and senators come to the hospital so that, number one, they can put a face to a name if they need to contact us in regards to concerns they may have, talk about future legislation, etc. So it's good to have them here. And you can see that Representative Landis is talking with Mary Hamilton, who was our OHA finalist for Healthcare Worker of the Year in this year's OHA program, and she was one of the finalists for that award. So we're very happy with her and very proud of her as well. The last other initiative that we have going on, Ohio's Safe Sleep is Good for Baby campaign. You can see that the picture emphasizes that we give onesies to new babies with the statement, "This side up." You may or may not be aware that Ohio ranks 48 out of 50 states in regards to the first 12 months of infant mortality. So we really want to improve that. We are trying to do that through providing these to new babies, as well as educate parents and family members in regards to healthy babies. So, in summary, you can see that we have several awards to celebrate. Our quality metrics are improving. Our patient perception of care, we stay around the median for all hospitals, continue to improve those. We took a look at where the emergency center will be located, and we talked about some benefit changes for our new PTO plan as well as our wellness screenings. And with that, would be happy to entertain any questions that you may have.